Hi, everybody. Dr. Daniel. Today I'm talking about the use of Nurtec ODT, one of the new acute therapy drugs for CGRP for migraine. It's also going to be approved by the FDA for preventive therapy, which is a new deal. So a moment about migraine. Migraine is a chronic medical condition. It's associated with headaches that may last 4 to 72 hours, which are moderate to severe in intensity. They're associated with sensitivity to light or sound and nausea or vomiting. Now, during the migraine process, 3 neurochemicals are released by the trigeminal nerve and its ganglion, and these neurochemicals are CGRP, neurokinin A, and substance P, and they're inflammatory to the brain. So right now, the best drugs for acute therapy of migraine are triptans, which block the release of these neurochemicals. You have to treat it early. All migraine should be treated early. And what's quoted there is that 70 to 80% of persons who take a trip to the onset of a migraine are headache-free in 2 hours, and no drug can beat that. These drugs are generic and they're cheap. But it would be helpful to have a drug for the other 30 to 20% of persons who have migraine who are kind of triptan non-responders. And this drug may be the one that does it. So Nurtec ODT has already been approved for acute therapy in the spring of 2020 and will be approved by the FDA in the second quarter of 2021. It's like the other CGRP drugs in that it doesn't have any cardiovascular risk factors associated with it, which is one of the problems with triptans. And that's probably why some patients can't take triptans or why persons don't use them, because they have risk factors. This drug can be used with patients with cardiovascular risk factors. And it's compatible with most all drugs. It works really well. Side effects are a rare group of patients may have allergic reaction with a rash, may have trouble breathing or swelling of the face, nose, and throat. That's pretty rare. The most common other side effect is nausea, present in 2% of patients. The other good deal here is this drug works really quickly, so that patients taking this can have fast migraine pain relief and get back to normal function within an hour. Some patients are really better within minutes, and it can deliver sustained efficacy up to 48 hours after it's administered. It's dosed as an oral dissolving tablet. That's what ODT means. Like a lozenge you put in your mouth and it just dissolves. And it's 75 milligrams, one at onset, and you can only take one within 24 hours. Nurtec did well on patient rating in a long-term study. It's also been found that you can take this with one of the other acute therapy preventive drugs called Ubrelvy, which is also a CGRP antibody. There was a phase 3 trial that Biohaven Pharmaceuticals, which was the group that brought this drug out, found that a significant number of patients had experienced a 4.3-day reduction in migraine taking the drug. The other thing was found with that study was many of those migraine patients were taking one of the preventive therapy injectable, subcutaneous injectable CGRP antibody drugs for prevention of migraine, and they could use safely the Nurtec ODT without any problems. Regarding safety, there were 1,800 patients who took Nurtec ODT for a year without any problems. They had one patient had a slight elevation of AST, which is a liver enzyme, to 45, where normal is 5 to 40. And in this treatment group, the patients took the medicine every other day for a month, which is like 15 tablets or treatments a month. I want to read a statement from Dr. Stock, who's the Chief Medical Officer at Biohaven. Unlike the injectable CGRP targeting biologics, Nurtec ODT offers the potential for convenient oral medication use for acute and preventive migraine. It requires no injection and has a half-life of 11 hours, which allows immediate cessation of the drug and therapy in case of pregnancy, nursing, hypersensitivity reaction, or adverse reactions. Then Dr. Korick, the Chief Executive Officer of Biohaven, stated, and I quote, "Patients with migraine deserve the simplicity of managing their disease with a single medication that alleviates acute episodes and works to prevent future attacks. Our goal with Nurtec development has been to offer a fast-acting, quick-dissolving oral tablet with dual-acting properties. So all this looks good, and so Nurtec ODT is going to be the first drug for acute and preventive therapy for migraine. Let's see how this works and follow it in later time here. Thought all you folks would like to know this. It's kind of big news. Thank you for watching and listening to this, and please click on subscribe and like down there. I'll see you again on the next talk.